Hello everyone, myself Dr. Mangesh Borkar. I am practicing as a consultant gastroenterologist and hepatologist at Manipal Hospital, Kharadi, Pune. Today we are going to talk about a very common topic which we see in our day-to-day practice, that is GI tract ulcers. So, a few decades ago, patients usually used to present with severe abdominal pain, hypotension, and directly they used to land up with complications of GI tract ulcers, for which they usually had to undergo a very morbid surgery. But nowadays, with the advancement of medical facilities, we can diagnose these GI tract ulcers at a very early stage and treat them with simple medications and lifestyle modifications. So we should know in detail about this topic. So we should know first how these GI tract ulcers are formed and why they are formed. First of all, our GI tract has a very good mechanism of defensive and protective factors against harmful agents like acid and bacteria. So GI tract, which has a very smooth lining, it is protected by another two layers. One is a bicarbonate layer, and on top of that there is a mucus layer. These two layers usually protect our gut lining from other harmful agents. There are various causes of ulcers, like first of all is a lifestyle, our irregular eating habits, then eating too oily or spicy, then stress is also a significant contributory factor, then few infections like prominent of which is a Helicobacter pylori bacterial infection, then some drugs like taking ibuprofen, aspirin, and nowadays since blood thinners are used rampantly, these is also very common causes of causing GI tract ulcers. Now, how do patients present in early stage and later stages? In early stage, patient usually present with nausea, vomiting, bloating, minor abdominal pain, fullness, and with the increasing intensity of ulcer, the pain intensity also increases. Sometimes patient presents with blood in vomitus, black stool, and sometimes they even land up in hypotension and sepsis, for which we have to hospitalize them and treat them accordingly. So our motive is always to prevent ulcers, prevent the complications, and we always suggest patient on how to do it. So you should, whenever you have symptoms at the earlier stage, you should consult your treating physician. So for diagnosing these ulcers, we usually do a simple upper GI endoscopy, which is a very simple and safe OPD based procedure. We can also do some few blood tests or a stool test for detecting Helicobacter pylori bacterial infection. After diagnosing these ulcers and their cause, we treat these ulcers with the help of medications and lifestyle modifications. First of all, we stress upon the lifestyle modification, like eating our diet at a very timely fashion, then avoiding too oily or spicy food, then taking proper adequate hydration, taking proper sleep, which most of us lack in today's stressful scenario, then not taking too much stress of our day-to-day activities or our work pressure. Then also if we find some infections like H. pylori bacterial infections, then we have to treat it accordingly with their effective treatment regimen of 2 weeks. Usually these GI tract ulcers are of two types, benign and malignant. Benign ulcers are usually the peptic ulcers, which do get healed with the help of lifestyle modifications and treatment. And whenever we see gastric ulcers, usually in elderly patients or patients with a family history of some carcinoma, then we usually suspect malignant ulcers. For diagnosing these ulcers, we usually take a sample during endoscopy and send them for histopathological examinations. And based upon those reports, we treat them accordingly, according to the stage of the disease. After this, once we are done with the diagnosis and treatment, we always focus on the prevention part. And in today's era, we should always consult a doctor at the very earliest symptoms and get them treated with a simple diet, lifestyle modifications and medications. Thank you everyone.